Now, the owner of Lloyds Pharmacies has put all of its 1,300 branches at risk of closure. It's a major blow for the high street. It's a major blow for all of us, isn't it? You're trying to pick up those pills.
Absolutely. Lloyds has struggled with losses for many years, closing more than 75 stores in 2022, with another 237 sites set to close in the next year.
Well, the uncertain future of the pharmacy is raising concerns, of course, for 17,000 employees and the many more thousands of customers. The company currently operates about 10% of all UK pharmacies.
Well, joining us now is the Chief Executive at the Association of Independent Multiple Pharmacies, Dr Leyla Hannbeck. Good morning to you, Dr Hannbeck. Really good to have you on the programme. How are you reacting to this news? Because this is big, isn't it? I mean, 10% of the pharmacies in this country. It's going to be a blow to the high street and a blow to the industry, isn't it?
Of course, Ellie. It's absolutely a national disgrace what's happening in England to pharmacies. And this has been going on since 2015, when our funding was cut. And so far, 650 pharmacies have closed. But as we were reporting, this is going to be accelerating with loads of pharmacies, for example, closing their Sainsbury's branches, but also some of the other branches. So we are going to see in 2023, this year, by end of the year, more than 600 pharmacies predicted to be closing their doors for good. And this is obviously going to have a big impact on the local population, particularly the elderly and the vulnerable, who are depending on their community pharmacy for their medicines, but also to have someone to speak to see a healthcare professional face-to-face, without having to book an appointment.
What is going on with community pharmacies? Because they are so important. If anyone had any doubts, they proved their worth during the pandemic. Pressures have increased on community pharmacies, but the funding agreement doesn't seem to have shifted. Why is that?
It's because for a number of years we've had, first of all, the funding was cut, but then on top of that, we had a funding that didn't take into account the rising cost of living, the inflation, and as a result, pharmacies were put in a situation where they're faced with longer medicine supply issues, and also cost of medicines going up, workforce challenges, and all of that coming together to make it a perfect storm for pharmacists not to be able to open the doors. It's something that we have been raising on many occasions with the government and with those in position of power within the commissioning services, that this is happening. So it's not something that they're not aware of. They know this very well.
And many of these stores that we're talking about are in rural areas. And I mean, it does bring up that issue of accessibility. And there are very few things more important than people getting hold of medicine when they need it. I mean, this is going to cause a big issue for many communities, isn't it?
Of course. It's about accessibility to medicines. It's about accessibility to care. It's about, for many people, they have their pharmacist as the only person that they can talk to, particularly lonely people who can't get appointments, for example, easily with a local surgery. So this is going to have a huge impact on the local population, particularly in areas of deprivation. And so it's something that we have been raising on a number of occasions with the government over the past few months. But unfortunately, our voices are not getting through.
We need to reassess, don't we, how we view pharmacies and pharmacists, because we forget that they are really the very first piece of the NHS front line. Absolutely.
Stephen, another thing that is happening as well is that they are asking pharmacists to do more and more. So we have heard Health Secretary, for example, talking about people should be going to their pharmacies more and more, with the rest of the NHS being under pressure. But what they don't understand is that these pharmacies cannot operate without additional funding. We cannot take on more work. And many of them are actually struggling as is in terms of keeping the doors open. So if nothing is done, we will see a huge acceleration in the number of pharmacies closing over the coming months and local population being severely affected.
Yeah, it's a depressing situation. Dr Hannbeck, really good to talk to you. Thanks very much indeed. Really appreciate it.